Let me talk to you today, not just as an oncologist, but as someone who has walked beside hundreds of patients and families through cancer. When people hear the word cancer, the first thing that hits is fear. Then comes uncertainty, then questions that don't stop. Will I survive? Will it come back? How will my family handle this? And somewhere in all of this, anxiety and depression quietly move in. Here is what I want you to hear very clearly. Feeling anxious or depressed during cancer is common. Studies show that roughly 30 to 40% of cancer patients experience significant anxiety. 20 to 30% develop clinical depression. It is not a weakness, and most importantly, it is treatable. Today, I will explain what is normal, what is not, and what actually helps. I'm Dr. Pachipala, who is board certified in hematology and oncology, and I practice in the greater Houston area. Please like and subscribe and share this with your family and friends if you like it. So part 1, what really happening? What causes anxiety? You have a cancer diagnosis, you've just been diagnosed with cancer. There's fear of death and uncertainty creeps in, and you start thinking about treatment side effects, loss of normal life and function. Start thinking about finances and family, and financial and family stress builds, and there's isolation and fatigue. All of these factors can lead to anxiety and depression. So what does anxiety and depression look like? Anxiety can look like constant worry, racing thoughts, trouble sleeping. Depression can look like loss of interest, low energy, hopelessness, feeling like a burden, withdrawing from loved ones. Now here is the key difference. Feeling sad or scared sometimes is human, but when it lasts more than 2 weeks and starts affecting your treatment, sleep, appetite, or relationships, that's when we call it clinical anxiety or depression. And that deserves attention, just like fever or pain. So why diagnosing anxiety matters? Because untreated anxiety and depression can reduce quality of life, make fatigue worse, can affect your sleep, decrease treatment compliance or adherence, decrease your immune function to fight cancer, increase emergency visits, increase the risk of infections, increase suffering and misery. So this is not just emotional thing we are talking about. Your mind and immune system are not separate worlds, they're connected. So what actually helps? Let's talk practical solutions. Number 1, good communication. Sometimes the biggest anxiety comes from uncertainty. When patients understand the treatment plan, the side effects, the realistic expectations, anxiety often decreases. So please ask questions. If you don't understand, say, "Doctor, can you explain that again?" Knowledge creates control. There are no stupid questions in oncology. Number 2, support systems are very powerful medicine. Humans are not designed to fight cancer alone. The most powerful protective factor against depression is social support. That can include family, friends, cancer support groups, survivors, counselors. Talking about your fears often reduces their power. Number 3, physical activity. This surprises many patients, but exercise is one of the most powerful antidepressants we know. Even light activity helps, such as walking, gentle yoga, stretching, short outdoor walk. The exercise releases endorphins and serotonin, which are the chemicals which are natural mood stabilizers. Even 10 to 15 minutes daily can help. Number 4, sleep protection. Cancer treatments often disrupt sleep, but poor sleep magnifies anxiety and depression. Helpful habits include regular sleep schedule, limiting screen time before bed, relaxation breathing, short daytime naps only. Good sleep protects emotional resilience. Number 5, music therapy. Music, even simple listening before chemotherapy, has been shown to reduce anxiety. It lowers heart rate, creates calm, improves emotional resilience. Sometimes healing does not require a prescription. Number 6, professional counseling. Many patients benefit from psychologists or oncology counselors. One effective therapy is cognitive behavioral therapy, or CBT. CBT helps patients challenge catastrophic thoughts. We often tend to think extremes. We think about worst possible outcomes. Replace them with balanced thinking. CBT also helps reduce fear spirals and build coping skills. Think of CBT as a physical therapy for the mind. Equally important, just like physical therapy, this is important too. Number 7, mindfulness and breathing. Mindfulness is not spiritual or religious. It simply means paying attention to this moment, this very moment, without judging it. Studies show it reduces anxiety and depression in cancer patients. Even something as simple like slow inhale for 4 seconds, holding for 4 seconds, and exhaling for 6 seconds, done 5 times, can reset your nervous system. Number 8, medication. Sometimes you need medication to handle anxiety and depression. Lifestyle and counseling may not be enough, and that's okay. Doctors may prescribe medications such as SSRI for depression and anxiety, short-term anti-anxiety medication, sleep aids if necessary. These medications can be very safe and effective when monitored by a physician. And remember, treating depression is just as legitimate as treating pain or infection. When to seek urgent help? Please contact your doctor immediately if there are thoughts of self-harm or suicide, severe panic attacks, inability to eat or sleep, total loss of motivation to continue treatment. That is urgent. That requires immediate medical attention, and we take this very seriously. The most important take-home message, let me say this clearly. You are not supposed to be emotionally strong all the time. Strength includes asking for help. Mental health is part of cancer care. If we treat the tumor and ignore the person, we have failed. So in conclusion, cancer is hard. It challenges your body, your identity, your family, your sense of control. But the anxiety and depression are treatable, and suffering in silence is not a requirement for being brave. If this message helped you, share it with someone who might need to hear it. And remember, you are not alone in this journey, not medically, not emotionally. If you like this video, please like, share with your family and friends. And thank you for watching.